Hello everyone, welcome back to the channel. Earlier we did see the diagnosis of poisoning, it's their clinical clues. Today we are going to learn a very important topic, that is general management of poisoning. Why am I calling this important? Because in emergencies like poisoning, the first step you can actually take is to save a life. Or sometimes if anything is done wrong, it can make things worse. So stay with me till the end and I will explain everything from stabilization, the ABCD steps, and what to do with the patient in the simplest way possible. Let's start with the chapter. Here, imagine a person is brought to the hospital after swallowing any kind of poison. Now tell me, what will kill him faster? The poison that is acting in his body will kill him faster, or the fact that he might stop breathing right now will kill him faster? But obviously, the fact that he might stop breathing right now will kill him faster. So that's exactly why whenever we treat poison, the first step is of stabilization. What it actually means that we don't run around and keep asking that which poison was taken first. Instead, we make sure that the patient's basic life functions are working, organs are responding well, right? So for that, in stabilization, we see for three steps, that is ABC. Here, ABC means A stands for airway. Airway, we see that is the throat clear? Person's throat is clear or not? Can the person breathe properly or not? And is there any kind of blockage in the airway? We check for these three signs, right? Then B is for breathing. In breathing, we see that is the chest moving or not? Chest is moving or not? And if oxygen is reaching to the person or not? And if not, what we do is provide oxygen or the person is in ventilator. Then comes to the circulation. C stands for circulation. We see that is the heart pumping blood properly? We check for pulse, blood pressure, and if not, they are given IV fluids if needed. We also check for vital signs like temperature, blood pressure, heart rate, breathing rate, because these signs gives early warning if the body is failing or not. And once the person's stabilization is done, the patient is stable and safe, we move to the second step, that is evaluation. What evaluation does is we ask for history. History as in ask when the poison was taken, how much quantity the poison was taken, and when was the poison taken. Sometimes relative come with medicine bottles that will help us to identify the poison. Second comes after history is taking examination. We look at the patient eyes, pupils, skin, any breathing problems. These can give us clues to understand what type of poison the person has taken. And lastly, we come for the test. We may check for the blood, urine, ECG, or any imaging studies to confirm the poison and see how the organs are working. So we have to remember a very golden rule, and the golden rule is we have to first save the patient's life. First, we have to save life, and then we have to look for the poison taken, right? Then we have to identify the type of poison taken. Here's a question wherein the question says a patient is rushed to the emergency room with suspected poisoning. Now I will give you three options where what I should do first. That is gastric lavage. Gastric lavage is simply washing of the stomach. Second option is antidote administration. And last is secure the airway. Most of the students will say that gastric lavage, washing of the stomach, because we need to remove the poison. That's okay. But if you think clearly and carefully, what if the patient cannot breathe? If the patient is not breathing, patient not breathing. Or what if the throat is blocked? Or the person has come to emergency room unconscious? Even if we do gastric lavage or give the antidote, he or she may die because oxygen is any which way is not reaching his brain. So the first step, as we learn, what we have to do is option C, that we have to secure the airway. It's a part of ABC stabilization. Airway first, then comes with the breathing, and then comes the circulation. Once the airway is clear and the patient is breathing, then we can think of other steps like gastric lavage or giving an antidote. So the correct answer is C, secure the airway. Why? Because without oxygen, the patient cannot survive long enough for us to remove the poison or give any antidote treatment. Next comes is stabilization. Whenever a poison patient comes to the hospital, our first basic priority is what? Stabilization. This means rapid assessment. Rapid assessment means we have to quickly check how serious the patient's condition is. And then we have to correct the life threatening problems. That we have to treat the patient immediately. We do not have to wait. Right? And then we have to follow the ABCD rule plus exposure. Let's break down again. A, airway. What we have to do is we have to check the throat is clear or blocked. If it is blocked via any vomit or secretions, and if airway is blocked, what we have to do is we have to do any suction method we have to proceed with. We have to insert any airway tube, or lastly we can do is intubate. Then comes is breathing. In breathing, what we have to check that is the chest moving, is oxygen reaching the lungs, and if not, what we have to do is give oxygen. We have to ventilate with a bag and a mask, or we have to put on ventilator. Then comes is circulation. We have to check for pulse, blood pressure, the capillary refill, and if the circulation level is very low, what we have to do is give IV fluids. We have to start with CPR if necessary, or we if the person is in shock condition, we have to treat the shock. D is disability. What do you mean by disability? We have to check for the level of consciousness. Is the person alert? If the person is not unconscious, we have to look for pupils. We have to check that if the person is not facing any kind of scissors, his blood sugar levels are proper or not. And if the person is in hypoglycemic state, we have to quickly give the glucose. Right. And lastly comes for the exposure. Exposure is fully expose the patient to look for clues like skin burns, any needle marks, or any bites, rashes. And mainly we have to prevent the person from to prevent any hypothermia. Next comes is airway. What we mean through airway is that think like airway is like a pipe carrying air from mouth to lungs. Pipe carrying air from mouth to lungs. If this pipe is getting blocked, that means oxygen cannot enter and the person will but obviously suffocate. So what symptoms we will be seeing? We will be seeing is dyspnea. Dyspnea is difficulty in breathing. Next we see is air hunger, desperate effort to breathe. And last we see is hoarseness. Hoarseness means voice becomes very rough or weak. Next comes as signs what we see. Stridor, stridor is harsh sound. We can listen while breathing. Next is retractions. Chest wall sucking in between the ribs or under the sternum while breathing. Cyanosis, bluish coloration in lips or skin. Why? Due to the low oxygen level. And lastly, sweating and tachypnea, that is rapid breathing and sweating due to the effort we are taking for the breathing. And how do we cure this? How do we manage this if any of the symptoms and signs are faced? We do the management is clear the airway. What do you mean by clear the airway? We have to remove the dentures, secretions, vomiters, and if needed, we have to give suction. Next is maneuvers, chin lift, jaw thrust. Chin lift and jaw thrust basically opens the airway in unconscious patients. Opens the airway. In where? Unconscious patient. Semi-prone position is recovery position to prevent aspiration. Definitive airway is if airway is not secure. What we have to do is endotracheal intubation. This is tube inside a windpipe. We have to do the endotracheal intubation if the airway is not secure. So we are done with the airway part. Next comes breathing. Airway is now open. We have checked with the airway. Airway is open. Next, what we have to check is breathing. If the person is actually breathing well and getting enough oxygen. For oxygen to work properly, four things must be fine. What are those four things? That is hemoglobin saturation. That is hemoglobin must carry oxygen. Hemoglobin must carry oxygen. We have to check for the hemoglobin level. Enough hemoglobin in blood. Normal oxygen unloading. Hemoglobin should release oxygen to tissues. Hemoglobin should release oxygen to tissues. And lastly, we see the adequate cardiac output, that is, heart pumps oxygen rich blood to body. Oxygen therapy. Oxygen therapy is we have to start with oxygen level with 28% mask. We have to check for ABG. ABG stands for arterial blood gas. If the low oxygen level is there, we have to increase the oxygen level to 35%. And what we have to target the partial oxygen from 45 to 55 mm Hg. Please remember the value, it's very important. And what happens that if breathing even after giving the oxygen therapy, if it's poor, breathing still poor, we have to start with this. Assisted ventilation needed when partial oxygen is more than 45 mmHg. That is too much carbon dioxide is inside. Too much carbon dioxide is there. And partial oxygen is 70 mmHg despite oxygen. So that if the patient has any acidosis condition and plus normal oxygen level, we can think of poisons that can block oxygen use like carbon monoxide, methemoglobinemia, cyanide, hydrogen sulfide poisoning. So these are various types. So poison which affect breathing is like depression, slow breathing. What are those? Like opioids, sedatives, organophosphate. Poisons which stimulates, that is fast breathing, that is caused due to amphetamines, cocaine, salicylates. And poison which causes fluid in lungs, that is heroin, salicylates, cocaine, carbon monoxide, NSAIDs, etc. Right? These are the cases. These are the red flags. Next we move on to is circulation. Once we have see the airway is clear, the patient is breathing properly, the next thing we check is for circulation. Why circulation? Because poison can cause shock, low blood pressure or dangerous heart rhythms. And if the heart is not pumping blood and oxygen is not reaching to the brains or organs, that will lead to ultimately death. So let's see how we will manage this. Initial steps to support circulation is correct acidemia. Correct acidemia means many poison patients have acid buildup in the blood. That means this weakens the heart. Acid buildup and therefore it weakens the heart. And we have to correct it with the oxygen fluids and sometimes we have to correct it with the sodium bicarbonate. Second comes is Trendelenburg position. This means that lie the patient flat with leg raised. That helps the blood to flow back to the heart and improves the blood pressure. Right? Third step, what is large bore IV line, that is 16 gram. We have to insert a wide IV line so that fluids and medicines can go inside quickly. Fourth step, saline bolus, that is 200 ml of normal saline rapidly. Children 10 ml per kg. And we have to then again recheck the blood pressure in 10 minutes. Fifth step is repeat bolus if needed. Watch for fluid overload. Too much fluid may overload the lungs, which causes pulmonary edema. So to prevent pulmonary edema, we have to recheck the bolus. If persistent hypotension, that means if BP is still low, we have to start with monitoring the CVP, that is central venous pressure. CVP is central venous pressure. That is, we have to start monitoring CVP and urine output to guide fluid therapy. Then we have to start with vasopressors, vasopressors, that is drugs that raise BP. These are drugs which raise BP, that is dopamine, 1 to 5 mcg kg per minute, which will slowly increase, and we can maximize this to 15 to 30 mcg per kg per minute. Noradrenaline dose is, we have to start from 0.5 to 1 ml per minute and of 16 mcg per ml solution to titrate, and we have to maintain the BP. Right? Next comes is circulation. Poisons often disturb the heart rhythm, right? So we always keep the patient on continuous ECG monitoring. How do we manage this? So the cardiac monitoring and arrhythmia, we manage for the first step is ECG plus continuous monitoring. We have to correct the basic problems like hypoxic state. If the person is acidosis, we have to check for any electrolyte imbalance, that is potassium, calcium, magnesium. And then we check is that if the rhythm is still abnormal. Continuation of circulation. As we know, the poison can disturb how the heart beats. It sometimes may beat too fast or too slow or irregular. That is why we have to always keep the patient on ECG plus continuous monitoring is done, like keeping the heart on a CCTV. Right. Then comes to steps to manage and fix the basic problems first. We check for oxygen. We have to provide oxygen if the person is in hypoxic state. We have to correct the blood acidity level if the person is facing acidosis. And we have to, but obviously, balance electrolyte, that is potassium, calcium, and magnesium. And after doing this, we still find if the rhythm is still abnormal. What we have to do? Treat this. And how do we treat it? Depending on the type, right? Depending on the type, it could be stable ventricular tachycardia, unstable rhythm, or severe bradycardia. If a person is having stable, fast ventricular tachycardia, we have to use medicines like lignocaine, amiodarone, sotalol. Right? Sotalol, we have to use it with caution because it causes QT interval. Right? If then comes with the unstable rhythm type, patient is in shock, very low BP and unconscious. What we have to do is we have to give a cardioversion, that is electric shock. Electric shock. And if a person comes with very slow rhythm, that is severe bradycardia, we have to give atropine. What atropine does is it speeds up the heart. It speeds up the heart level. Next is lignocaine dosing. For dangerous fast rhythm from ventricles, adult dose first, this is given by bolus. Bolus 1 to 1.5 mg per kg IV. We can repeat it if needed. Maximum range is 3 mg per kg and total for 300 mg per hour. Maintenance dose is maintenance drip is given, that is 1 to 4 mg per minute, and children bolus dose is 1 mg per kg and infusion is 20 to 50 mcg per kg per minute. In short, we have to first fix the oxygen, acidity, then electrolytes. And then we have to use lignocaine carefully, keeping within the safe dose. Next, we proceed to disability, depressed consciousness. This mainly means that check the patient's brain. We move on to the next disability, depressed consciousness. Now what means is we check the patient's brain function. Checking patient's brain function. What do we mean by this is the person alert, confused, or unconscious? So CNS depression and poisoning is when the patient has decreased awareness, often seen with the Glasgow Coma Scale, that is GCS, which is more than 8. Glasgow Coma Scale is the scale for assessing brain function. What we have to note is that Glasgow Coma Scale is good for trauma patients, but in poisoning we cannot always rely, right? So what are the causes for CNS depression? If a person has consumed opioids like morphine or heroin, or person has consumed alcohol, sedatives like benzodiazepine, barbiturates, or any other toxins. So what's the rule? Always we have to give 100% oxygen by mass, that is 8 to 10 liter per minute in any unconscious poison patient. Next, sometimes most of the student ask me that some patients pretend coma in suicide attempts, right? So the person who pretends to be coma in suicide attempts, that is known as psychogenic coma. We must always differentiate it from the true poisoning coma. Like there are clues for psychogenic coma, that symptoms like don't match with severity. It often seems to be dramatic. And there are features of suicide gestures. So for that, what we do is gentle bedside test. Gentle bedside test is hand drop test. What we do in the hand drop test is that lift the hand and let go. And in psychogenic coma, it falls to the side and not on the face. Right? Next, we check for tightly clenched claw. That means if there's a clenched claw, normal gag reflex, and stable vitals, that suggest of psychogenic. We have to avoid any kind of cruel test like slapping, nipple pinching, or using ammonia sticks. They are now outdated and are often unethical. These are unethical. Coma cocktail is historical approach. In the past, doctor used a coma cocktail for all the unconscious patients without knowing what kind of poison it is. So what they did was giving dextrose 100 ml or 50%. Why this is given? To correct the low blood sugar. Next is thiamine 100 mg to prevent brain damage from thiamine deficiency. Naloxone 2 mg to reverse any opioid overdose. But now evidence says that routine use is not recommended. Instead, we give any specific treatment after checking the patient. So in short, what disability means? Disability means to check the normal function of the brain. CNS depression, which is caused due to opioids, alcohol, sedatives. We have to give 100% oxygen mask to all the unconscious patient. Then we have to differentiate between psychogenic coma and true coma. And then we have to give the coma cocktail, that is dextrose, thiamine, naloxone. That is historical. It is not used right now. Next, we to the last is disposition. Once the stabilization of a poisoned person, that is ABCD, is done, now we have to evaluate them. And next, the question comes in the mind: where do we have to keep this patient? Should they go home or stay in ward, or they need any kind of particular ICU? So this is called disposition. What we will do? Where to keep this patient? So there are ICU criteria. Before that, we will be learning if any person has comes with mild toxicity. If a patient has only mild poisoning and no symptoms, we have to just observe in the emergency department for 4 to 6 hours. And if they stay asymptomatic, they can be safely discharged to home. Then we have to see first, as we learned, is mild toxicity. Second, what we will be learning about the moderate risk. Here in moderate risk toxicity, if the patient has some risk or moderate poisoning, we have to admit to the observation or ICU because we have to monitor the levels. Next, if there's a severe toxicity. Severe toxicity, if poisoning is very serious or can cause life-threatening, we have to directly admit to the ICU. And lastly, there's a intentional overdose is taken. Intentional overdose or in the suicidal condition, even if the patient is stable, patients who have attempted suicide must undergo psychiatric treatment assessment before they have been discharged. Now, what is ICU admission criteria that are red flags? Some features are so dangerous that they directly qualify the patient to go to ICU. And what are those seen? Partial carbon dioxide levels are higher, means too much carbon dioxide. Then there is a risk for respiratory failure. Emergency intubation. Here, the airway is not secure. Person is feeling seizures after post ingestion. Then comes with the unresponsive to verbal stimuli, means deep coma state. Abnormal heart rhythms is seen. Systolic is greater 80 mmg. QR is less than or equal to 0.12 seconds, means ECG abnormality suggestive of danger arrhythmia. Older age or abnormal body temperature. Higher mortality risk. So disposition is where decide where the patient will go after the emergency room. If it's mild, 4 to 6 hours and discharge if fine. Moderate, admit to observational unit or severe ICU. And all intentional overdose will need psychiatric evaluation, and these are the ICU. If you found this explanation helpful and easy to understand, then do give it a like, share it with your friends, and drop your comments below. I did love to know your thoughts. And don't forget to subscribe to stay connected for more such simple and interesting medical teachings. Thank you.